ExCPT Practice Exam Pharmacy Technicians Mock Test and Review. 25 must memorize questions. Question 1. What is the generic name for Lipitor? Simvastatin, atorvastatin, levastatin, pravastatin. Atorvastatin is the generic name for the cholesterol medication Lipitor. Question 2. How many ml are in 1 teaspoon, TSP? 2 ml, 5 ml, 10 ml, 15 ml. Standard pharmacy conversion, 1 TSP equals 5 ml. Question 3. Which law requires pharmacists to perform drug utilization reviews? DIR, HIPAA, OBRA 90, Controlled Substances Act, Pure Food and Drug Act. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, mandated DIRs and patient counseling for Medicaid patients. Question 4. What does QD mean on a prescription? 4 times a day, once daily, every other day, before meals. Although QD is on the do not use list, it traditionally means quaque die or once daily. Question 5. What is the storage temperature for refrigerated drugs? 32 to 40 degrees Fahrenheit, 36 to 46 degrees Fahrenheit, 40 to 50 degrees Fahrenheit, below 32 degrees Fahrenheit. Standard refrigeration in a pharmacy is 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. Question 6. Which DEA form is used to order Schedule II controlled substances? Form 41, Form 106, Form 222, Form 224. DEA Form 222 is used for ordering and transferring Schedule I and II drugs. Question 7. The process of grinding a powder into a smooth paste is called trituration, levigation, spatulation, pulverization. Levigation involves adding a small amount of liquid to a powder to make a paste. Question 8. What is the maximum number of refills allowed for Schedule III/IV drugs? No refills, 5 refills in 6 months, 11 refills in 1 year, unlimited. Federal law allows up to 5 refills within 6 months for CIII and CIV drugs. Question 9. Which of the following is a look-alike/sound-alike LASA, pair, Humalog and Humulin, amoxicillin and penicillin, aspirin and ibuprofen, metformin and insulin? Humalog and Humulin are classic LASA examples that require extra care to avoid errors. Question 10. How many grams of dextrose are in 500 ml of D5W, 5G to 25G, 50G to 250G? D5W means 5G/100 ml, so 5G*5 equals 25G. Question 11. Which suffix indicates a beta blocker? Pril, olol, sartan, statin. Olol is the common suffix for beta blockers like metoprolol. Question 12. What is the generic name for Zoloft? Fluoxetine, sertraline, paroxetine, citalopram. Sertraline is the generic for the SSRI Zoloft. Question 13. Which DEA form is used to report the theft or loss of controlled substances? Form 41, Form 106, Form 222, Form 224. DEA Form 106 is for loss or theft, Form 41 is for destruction. Question 14. What is the Orange Book used for? Pricing, drug interactions, therapeutic equivalence, side effects. The Orange Book lists approved drug products with therapeutic equivalence evaluations. Question 15. How many ml are in a 1 liter bag of normal saline? 10 ml, 100 ml, 1000 ml, 10,000 ml. 1 liter equals 1000 ml. Question 16. What does PRN mean? As needed, immediately, after meals, nothing by mouth. PRN stands for pro re nata, meaning as needed. Question 17. Which medication is classified as an ACE inhibitor? Lisinopril, losartan, amlodipine, furosemide. Pril is the suffix for ACE inhibitors. Question 18. A prescription for 1 tab petid means take 1 tablet by mouth twice a day, take 1 tablet by mouth 3 times a day, take 1 tablet by mouth every 12 hours, take 1 tablet by mouth before bed. TID equals turn die, 3 times daily. Question 19. What is the maximum amount of pseudoephedrine that can be purchased in 30 days? 3.6 g, 7.5 g, 9.0 g, 15 g. The Combat Methamphetamine Epidemic Act limits 30-day purchases to 9.0 grams. Question 20. Which of the following is an auxiliary label for a suspension? Take with food, shake well, do not crush, avoid sunlight. Suspensions must be shaken to ensure uniform distribution of the drug.